Okay, start recording. Percy, can you tell just a little bit more about yourself, what you're doing here, how did you get here, and your experience?
Certainly, Dr. Dulitsky. My name's Percy Allen, and if you Google my name, you can find out about my background. The reason I'm here is I had pain in my kneecaps, and I also had pain in my wrist and my hand, and I'll talk about that separately. I came here to see if something could be done about it, and Dr. Dulitsky offered an ozone injection therapy, which I've had for the last few weeks, and it's made a huge difference. In the case of my kneecaps, it means I can now walk, not only along the street, but also up and down stairs without pain, whereas before I had severe pain. In the case of my wrist, I broke it a year ago, and I had an operation, a very complex operation, that left the wrist painful, but more importantly, I lost a lot of the use of my hand, which had developed severe arthritis in the fingers, which is often a natural outcome of such operations. And while I'd gone to hand therapists and physiotherapists, which had helped a little bit, I still had a lot of problems with my hand, especially typing, as I do a lot of research. And through Dr. Dulitsky's ozone injection therapy, I've managed to get rid of most of that arthritis. The hand's mobile, my wrist is perfect, and as I mentioned, with my kneecaps, I can now walk properly and I can go up and down stairs without pain. So I'm very grateful to Dr. Dulitsky for what he's been able to offer me, and I'm also grateful to his assistant, Valentina, who is a brilliant physiotherapist, chiropractor, who's been able to manipulate my spine and my hips to straighten my back and also my hips, because a lot of the problems in my kneecaps came from a misalignment of my spine and hips. So she's fixed the underlying problem, and then Dr. Dulitsky, with his ozone therapy, has been able to get rid of the inflammation and the arthritis and the overlaying problem that had arisen from the misalignment of my spine and hips.
And do you have much pain recently? How's your situation now? Do you still have any pain?
I've got a little bit at times in my kneecaps, the left kneecap, but look, it's 95% better. It's almost gone completely, whereas before it had become quite severe, and I had difficulty walking along the street, keeping up with my wife when she was walking. And now I can walk perfectly, and on the staircases the pain has gone almost completely. I can mount staircases, I can descend staircases. There's just a little bit left, but hopefully that'll go soon. In the case of my hand, it's also 95% fixed. I can type, I can use it, there's mobility. So I'm very happy with the progress I've made, because what I was doing before with physiotherapists wasn't really working.
So have you tried other treatments before?
Well, I've been to a hand therapist to try to fix this problem, and they gave me various exercises which helped a bit, but it didn't really fix the problem. And I also went to a physiotherapist with the hips, and he tried several times to realign my spine, but without success. Valentina was able to do it within a quarter of an hour. So yes, I have tried alternative therapies. Also, I was very frightened that I might need some sort of hip replacement or knee joint replacement. I'm pretty confident I won't need that now, because my situation has improved.
Would you recommend this treatment to others?
Yes, I would. And I know in Australia there's only one or two practices that offer this treatment. The problem is that while it's becoming very common in America and it's common in Europe, and athletes use it in those countries, it's not well known in this country. It's not recognised under Medicare. It's not recognised officially. So it's good that in Australia someone like Dr. Dulitsky can offer this treatment, because otherwise we would have to travel overseas. And because you've got to come for these treatments, it can't be just done in one go. You've got to come back several times. If you were to go overseas, you might have to spend a month or two overseas visiting a doctor to have this done, whereas here in Australia you can have it done at Castle Hill yes, you do have to have some repeated visits, but I prefer to do something that's within reach of my home than having to go overseas for this treatment.
Okay, thank you very much.
You're welcome, Doctor.